Hello and welcome to Baby Help. I'm Dr. Sandeep Gupta, Senior Pediatrician and Child Care Expert. Today I'm going to talk about the general care of the newborn baby. So this is very interesting and a common problem for many parents. Nowadays, because of the nuclear family, many times only mother and father are there to take care of the baby and no elderly people are available to guide them and make them understand what is happening to the baby, and so they get very nervous and get confused about the care of the newborn baby. So that's why I'm making this video highlighting all the important aspects of newborn care, right from the breastfeeding to stool and urine of the baby and different part of the newborn care. So coming to most important part of the newborn care is breastfeeding. So because breastfeeding is actually complete nutrition till 6 months of age for the child, and it covers all the calorie requirement, protein requirement, minerals, vitamin requirement till 6 months. It also builds a very good immunity for the baby and prevents infection, which is common with the artificial milk feeding. So artificial milk feeding, because you are giving from outside, there is always a risk. No matter how much you try to make it clean, there's always a small risk that you may get some infection, because bacteria, viruses, these are always there in our surroundings and it can get into the artificial milk and cause problems. So best is to do breastfeeding, and it also has many advantages. Not only the nutrition part, there is the immunity part, there is a long-term benefit in terms of having better IQ, prevention of diseases like obesity, asthma, allergy. So I have made separate videos on what are the advantages of breastfeeding for child, what are the advantages of breastfeeding for mother, how mothers can increase their breast milk production. So these all videos are there in the link of this video. You can actually go and watch those videos to understand the benefit of the breastfeeding in details. Now coming to the second most important part of the newborn care, that is the bathing of the baby. So bathing of the baby, the first thing you should remember is don't need to bath the baby in first 24 hours of life. So first 24 hours of life, if you bath the baby, there is a risk that baby will become cold. So try to avoid in first 24 hours any bathing of the baby. So keep the baby wrapped in clean clothes first 24 hours. After the first 24 hours, till the umbilical cord falls, umbilical cord you understand, which is attached around the navel. So that umbilical cord connects the baby with the mother in the uterus during the pregnancy time. So what happens is, when we cut, as doctors, we cut the umbilical cord, some small amount of stump is left over, part of this umbilical cord is left over, which generally shrinks and dries and falls off by 7 to 10 days. So what we say is, don't do bathing by pouring water on the baby till 7 to 10 days, till the umbilical cord has fallen off. Till then, what you should do is sponge bathing. Sponge bathing is nothing. You just take a clean cotton cloth, put it in lukewarm water, squeeze it, and then apply the cloth all over the body to clean the body, and make sure you clean the hidden part of the body, like under the neck, back of the neck, groin, armpits. These areas should be properly cleaned. So this is very important to know about bathing. Now one more important question about bathing is, how long to bath the baby? The answer is 5 to 10 minutes bathing is sufficient for the baby, because if you bath the baby longer, what happens is the skin moisture will go away and skin will become dry, child may get rashes and all these problems might happen. So try to avoid bathing more than 10 minutes. Keep it between 5 to 10 minutes. That is the ideal time to do bathing. Now coming to the general skin care of the baby, use gentle soaps for bathing of the baby. Don't use soaps which are used for the adults. So use gentle baby soaps like Dermadew soap, Teddy Bar soap, or Sebamed soap, which are specifically made for baby and will not have alkaline pH. So very important to know this. The other thing is which oil to apply on the baby's skin. So generally skin massage is done by coconut oil. I recommend personally to use good quality coconut oil, because not only it prevents the moisture from going away from the skin, it actually maintains heat of the body. So happens is it prevents heat loss from the skin and maintains the skin temperature. Other thing is, coconut oil has medium chain triglyceride, which maintains the nutrition of the skin, and it can be absorbed through the skin and helps skin to become much healthy. This is very important to know. Another question which is asked by the parents is, how many layers of clothing should be used for the baby? So clothing of a baby is very important aspect, and clothing should be one layer extra from the what adults are feeling comfortable in that season. So suppose in winters you are wearing 2 layers of clothes, baby should wear 3 layers of clothes. and in summers when we are using one layer of cloth, baby will use one more extra layer, so that is 2 layers of cloth. The reason being baby's skin is very thin, so they need one extra layer of clothing to maintain their temperature. Now coming to the diaper or the nappy part, so generally the diapers are very much convenient for many parents, and they believe the diaper is good because of the marketing of the different companies. Diaper companies market them as very wonderful product, but actually diapers are not a great product. What happens is the diaper actually retains the urine and stool which is passed by the baby, and these urine and stool have chemicals which irritate the skin. So diaper absorbs the urine and stool, and chemicals of the diaper actually keep in contact with the baby's skin. So what happens, baby's skin will develop diaper rashes. So best to avoid diapers unless you are going out in a public place, or in the night maybe you can use diaper, but when you are in daytime or at home, try to use as much as possible cotton nappies. So cotton nappies will actually prevent this diaper rash situation for your baby. Make sure that you wash the cotton nappies, cotton cloth nappies before using it, because when the cotton clothes are stored, there are a lot of chemicals in that which can cause again skin rashes. So wash it in soft detergent and then use it on your baby. This is very important to know. Now the last aspect which is very commonly complained by the mothers and parents is that baby after feeding sometimes vomits and curd like milk comes out. So the reason for this is when the baby is actually swallowing the mother's milk, it is swallowing little amount of air also. That is because the baby's swallowing is not perfect. So it tries to swallow the milk, and then with that it also swallows some air. So air goes and sits in the stomach. After some time that air comes out, and with that it will take out some amount of milk. So first thing is you should not be worried about it if it is only less than 5 or 10 ml. The second important thing is how to reduce the amount of this milk coming out. The ideal way to do is do proper burping. Burping means keep the baby upright and gently tap the baby on the back till the amount of air comes out. So I'll finish this video with this much information. I hope this video is very useful for all of you. If you like this video, please subscribe to my YouTube channel. You will get a notification of further more videos like this, and also share it with your friends and other parents who may find this video useful. Thanks again for listening to me.